Good morning and you're welcome to Health Check this morning on GH Today. My name is Nanama Ano Bempong and we are here at Dr. Agawo's Eye Hospital, and I'm speaking today to Dr. Asiome Seneaja, and we are talking about cataracts. As you can see with all the machinery around me, it's about eyes today. You're welcome.
Thank you very much.
We're talking today about cataracts. What is cataracts?
Well, cataracts is the cloudiness of the lens. We all have natural lens in our eye. This lens helps us focus near and far. And as time goes, this lens changes because they are made up of protein. They tend to be clouded, meaning that you are not able to see through clearly, and that is what we call cataract, and that is what actually brings down the vision as a result of the cloudiness.
How many people in Ghana have cataracts? Is it something that is common?
Well, the figures are quite high. We are talking about 50% of the total blindness that we have, and it range in the hundred thousands of it. But we have different type of cataracts. We have those cataracts that are very mature and unable to see, which are total blindness. Then we have cataracts that have just reduced vision. When we combine both, the figures are quite huge. Cataracts, in the whole world, it's about the major leading cause of blindness. The good thing about cataract is that it's reversible. So you can have cataract, and when you remove it, then you are able to see. Unlike other diseases like glaucoma, whereby you can reverse vision, cataract surgery, you can reverse vision. So many people who have cataract surgery without any other diseases will regain their vision.
What are the signs of cataracts? How does one know that he or she has cataracts?
This includes blur vision. That means you are not able to read, you are not able to see faces clearly. When you are in a driving, especially those who can still see a bit, they have glare. That means oncoming vehicle will make them not be able to see. That is a sign of cataract. It is change in position. You are in the sun and then you come to the light, or you are from the darkness to light. You have difficulties. Those are the signs. But like I've said, because of other diseases that may all have the similar sign, it's always good to check.
So how dangerous is cataracts to your sight?
Well, it's not dangerous. Just like I was saying, cataract surgery, cataract per se, once you remove it, vision comes back. Provided there is something at the back of the eye which is contributing to the poor vision. First, the surgery is not that complicated, and people are able to regain their vision with different type of lenses we plant these days in the eye. So yes, this is the status of getting back your vision when we actually treat you for cataract.
Can you show me the examinations that are required to be able to detect cataracts?
When you go to the hospital, first of all, we take vision. Vision is the first thing to know. Then you go through what we call pressure, because we need to differentiate between cataract and glaucoma. I kept mentioning glaucoma because it's the dangerous one. You can't reverse that one. If everything is fine, we do another test called biometry. Biometry is a way to determine the power of the lens that is required. Okay. Unlike in the past where we just put in one type of lens, today we can customize the power. So even this eye may take power 15 and this one may take power 16. Yeah. We even have a way of putting in a lens that can be seen near and far. Okay. Even in advance now, we can even we can even plant glasses in your eye, or what you call lenses, that can be used for near and far. Those are a little bit pricey, but they can help. So this is how far we've gone with treatment now. When the view allows us, we can even do what we call optical coherent tomography. That is scanning the back of the eye, because sometimes diseases can affect the vision after surgery. We call it OCT. OCT can help us see the integrity of the macula, which will tell us, no, this vision is not going to be good, this vision is going to be good. So these are all the tests we do now. Yeah.
So what are the treatment options? You mentioned a couple, but if you can go in a bit further for us.
Generally, we have, I'll fairly say, 3 types of surgery. Number 1, the treatment is surgery. There is no other option that we have apart from surgery. I hear people come and say, can you give me an eye drop to melt away my cataract? Sometimes you see some of those on the internet. Now, we only have one way of treating cataract. That is surgery. We go in and replace the lens with artificial lens. That artificial lens will stay in the eye for life. We even do that for babies who have cataract. So it is nothing that you should be scared of. The materials have gone through a lot of study for many years, and there has not been any problem. One type of surgery is we make an incision and then implant the lens in the eye. Okay. That incision, we call it small cataract incision surgery. It's not that big the way it used to be, but it's still big enough for the lens to go into the eye. Usually we choose to do that when we are using what we call rigid lenses. There is another advanced one which we call phacoemulsification. What does that is that practically you go into the eye, you break the cataract into pieces and you suck it out, and then you put in a lens that can just fit in through a very tiny hole. That tiny hole seals very fast, so the visual recovery is very good, and you have all the necessary treatment within a very short time. Today, that surgery is within 10 to 15 minutes, and the visual recovery is excellent. That small cut, we could also use laser to do it. It just makes the healing much faster, but the process of breaking down the lens and sucking it is just the same.
I just want you to also encourage those that have or that may have a possibility of cataracts, because when you are talking about cutting of the eye and inserting things into your eye and things like that, I don't know if you can maybe encourage people that it's not as painful as it sounds.
Yes. The advances, yes, it's when we talk about operation, people get scared. Well, if I were them, I was going to be scared as well. But one thing is that we make the place numb. Okay, what we call blocking. You will not feel pain at all during that. Maybe the time we are blocking, that is the time you may feel something. But within a very short time, the pain goes. So you will not know that anything is happening to your eyes at all. We may even use eye drop if you are scared of injection a needle to the side of the eye. We may use even eye drop, and that eye drop is so good that you may not even feel it. You just feel the doctor touching you, but you will not feel pain. Because of the speed of the surgery, it doesn't take long. For instance, the eye drop one, you open your eyes soon after surgery and you start using the eye drops, and your vision comes immediately. So there's a lot of advances made in cataract surgery. It's one of the oldest, before Jesus. Yeah.
Okay, and then what are the preventions for cataracts?
There is no scientific evidence to date that this particular thing can prevent cataract formation, because it's age. It's like I said, like developing gray hair. But we know that healthy lifestyle can always delay everything. Well, I think that we see some who develop the cataract very late, some quite early. We know people who work outside, exposed to UV light will tend to have, like people who go to the sea and work, they tend to have cataract much earlier. But there is no strong, and there's no any strong scientific evidence that if I give you this, you will develop cataract late. But my advice still goes for good health, good food, good exercise. All can help in one way, in any way, because the comorbidity, that means the diseases that come with the glaucoma, are also very important by the glaucoma, which we may talk later. So this is very important to understand, that there is no, it's just like asking me, is there anything to do to prevent gray hair? Very difficult.
Dr. Senyaja, thank you so much. Thank God I don't have any cataract.
I don't.
Thank you so much for watching us on Health Check on GH Today. My name is Nanama Anna Bempong. See you again next week.